So, we all kind of belabor these points. The negative impact of PN and itch on our patients. Clearly, these patients suffer from severe, relentless pruritus that causes them to scratch till they ulcerate their skin, till they develop these nodules. Patients, as we've said before, have significant depression and anxiety. There have been increased rates of these and other psychiatric disorders in PN patients compared to healthy controls, and even patients with other inflammatory skin diseases, such as atopic dermatitis, psoriasis, or others. There becomes an issue very frequently in many patients with sleep disturbance, partly because of itch, partly because of repetitive behaviors, and even the depression and anxiety. And finally, this all culminates in pretty significant psychosocial disturbances. Patients often report feeling ashamed or embarrassed, and really this condition leads to a lot of social isolation. And these are things we need to take into account when we're thinking about how to treat PN. So the goals of any PN treatment include relieving itch, really by any means or combination therapy, as we've discussed. Breaking that itch scratch cycle, which, as Brian discussed, really leads to the widespread nature and existence of this disorder, healing those nodular lesions, and thereby improving quality of life. And this really resonates with the study that was done in Europe, where they looked at 406 patients and asked, what were their primary therapeutic goals. These included reducing pruritus in 80% of patients, improving lesions in 57% of patients, and improving sleep in 31% of patients. These were their top goals. So the current approaches for managing PN include topical therapies, phototherapy, or widespread skin therapies, intralesional therapy, and even intralesional steroids, intralesional or just topical cryotherapy to focal areas or even widespread lesions, systemic immune suppressants and modulators, as well as systemic neuromodulatory therapy. It is critical that for any patient, you are considering their age, their comorbidities, the severity of their PN, as well as the impact on their quality of life, as well as the safety and tolerability profile of the therapy chosen. And I also want to emphasize, we're going to work through some of the specific agents in a moment, but most of the evidence supporting these treatments for PN, conventional treatments thus far, have really been based on case reports, observational studies, and very small clinical trials. And for many of the therapies that we use in dermatology to treat PN, we lack any data actually specifically for PN. So I was fortunate enough to participate in a panel of U.S. experts who manage patients with PN recently, and we proposed a treatment ladder for the management of PN using all agents, whether they are traditional, approved now, or investigational. And based on this consensus statement, we developed a treatment ladder that has 4 tiers. You see on the bottom layer, tier 1, that's mainly topical therapies, and then working up through 2 through 4, we see either systemic therapies or widespread treatment therapies that, as you increase along this ladder, have increased toxicity or lack additional evidence. And I just want to note that any patient that you meet can enter this ladder at any point, depending on their individual profile and concerns, the severity of their PN, and you can move up or down the ladder based on their treatment response.